Honorable Chairperson, respected panelists, and learned audience, a very good afternoon. In the screen, you can see a beautiful picture of fountain, but today I'm going to show some cath lab facts that fountain are not always pleasant and hardware can give you a hard time. My patient is a 49-year-old male who presented with exertional chest pain for last 2 months on the background of hypertension and smoking. ECG showed tube inversion in the anterior lead, and in echocardiography there was anterior septal wall hypokinesia with an ejection fraction of 48%, and the ETT was positive in the first stage. So we plan to do coronary angiogram, and in coronary angiogram there is about 80% stenosis in the proximal part, and RCA was normal. So we plan to do PCI to LAD. So we wet the vessel, pedilate the vessel with 2.5 12 millimeter balloon and place the stent. Everything was fine till now. Then we trying to inflate the balloon. We tried once, the stent was not inflating. We tried twice and thrice, but the stent was not inflating. What it could be? Whether there is any defect in inflation device, so we changed the extension tube and tried again, but we failed. Then we changed the inflation device and again we failed. Then we avoided the extension tube and attached the inflation device with the catheter and tried, but we failed. So there's a confusion whether the stent is partially inflated or not. If we pull back the stent, whether the balloon comes out and there's a stent dislodgement. So we took a second wear of the second stent from the same brand and tried to inflate it, but the stent not inflated. We repeated the procedure. We we took new extension tube, new inflation device. We changed hands who were inflating the device, but we failed to inflate the stent. So it was quite puzzling while we are discussing why the stent is not inflating. The patient was becoming very uncomfortable. So we sedated the patient, took out the second stent and placed the third stent, and in the name of God we inflated, and finally this was easily the third stent inflated. So we post-dilated the lesion with 3.5 12 millimeter balloon, and this is the final picture. So why the first two stent not inflated? We tried to find out and did what we did inside the coronaries, we did outside the coronaries, and we can see the water spills out like fountains from the proximal to the stent. This was the first stent, and from the second stent also there's a leakage distal to the distal part of the shaft, and also a tiny leakage in the proximal part. We took a closer view of the stent. The stent seems okay, both the stents seems okay. So we reviewed the coronary angiogram. You can see that while the balloon was, while the stent balloon was not inflating, there is some dye leakage in the proximal part. And this leakage was visualized in the coronary angiogram, this leakage. So as I told you, that fountains are not always pleasant and hardware can give you hard times. I'd say that we have heard of incomplete stent balloon extension if the coronary bed is not well prepared by pre-dilatation or there is coronary calcification. But I have never seen or heard of this kind of leakage in stent balloon or shaft of the stent catheter device. So I tried to present this case. Thank you all for patience hearing.